Greetings and welcome to yet another Girl Who Don't You Know. It's me, Marilyn Green, the hostess with the mostest, right? And I'm here tonight, or whenever you're looking at it, morning, whatever. I'm just happy that you're looking at it, right? I'm going to be talking about a topic that is dear to my heart, because it's all about our community. And I got a amazing guest on. It's going to be talking about health equity. So let's set the stage right now. So you may say, well, what is health equity? All right. Health equity, we'll get the definition. Health equity targets underlying social advantages and disadvantages which contribute to different health outcomes between groups. Now, let's talk about some more data here. Did you know that nearly 500,000 babies in the United States are born prematurely each year? Women of color are up to 50% more likely than white women to give birth prematurely, and their children can face a 130% higher infant death rate than children born to white women. This information comes from 2018 Marchant Dines Perinatal Data Center. Now, let me tell you some more stuff. I'm not done here. The latest data shows that Black women in the United States have a maternal mortality rate of 49.5 for every 1,000 live births, nearly 3 times higher than their non Hispanic white counterparts. Okay, so in some of the reasons, and we're going to get a deeper dive in this with my guest, but some of the reasons behind the country's high maternal mortality numbers is racial disparity, including lack of health care coverage, no guaranteed paid parental leave, that's huge, less robust postpartum, that's huge too, and racial discrimination. So, and if you want to talk to me about where she get that data from, all you gotta do is just write me. I got all the information right here. Trust me, I do. All right. So let's get started. And I'm going to introduce a person that I believe knows what she's talking about. Because guess what I know? She says she's a health equity expert. All right. And we're going to talk to her and get a deeper dive and talk about some of those alarming numbers. I mean, things that are, to me, things that are really killing women, and we don't even know about it. I know I have experience, and I'll just say I have a live experience of, I know someone who had a child and they died at birth, right? I know someone in postpartum where they had psychosis and all that after postpartum. It's because they are not informed enough to know that something is wrong with their body. It's not like a long time ago when mom and them was having babies in the field and just get up and just keep moving. It's not that anymore because our diet is different. So I won't talk anymore. I'm going to bring her up. She's right here, and her name is Dr. Maria Flowers, the health equity expert. Dr. Maria, what you got to say today?
Well, first of all, Marilyn, thank you so much for opening up your audience to me to talk about this really important topic. Um, Extremely grateful to be here to speak to your viewers on this platform and to answer whatever questions you may have that can help anyone out there that may have had any history of suffering from this issue or know someone that's been impacted by it.
Right. You're more than welcome to come on my show anytime, so you know. So let's talk about it. I kind of gave the definition of health equity, but I guess my question to you is that how did you get into this? What happened? Do you have any lived experience or something dear to your heart that made you say, I need to investigate this more? What's going on?
Well, I've been in healthcare most of my adult career. It's over 25 years. And in my healthcare career, I've seen a lot of things. My corporate experience is in administrative roles, managing risk and patient safety for some of this country's largest healthcare corporations. And in that role is where I saw some things that I was not pleased with. And so when I went to pursue my doctorate in education, organizational change, and leadership, I decided to dedicate my doctoral dissertation to this very matter, to why we're having this issue. Why is healthcare unsafe in the United States? Why is there a health equity issue? And I sought to address that question in my dissertation research. And that is what brought me to where I'm at. I started to do some digging as I was writing and uncovering some things that paralleled with things that were going on in our nation and things that I was seeing that were happening in organizations. I felt that it was time to dedicate my skill to hopefully finding solutions for the problem.
Wow. And we talk about the problems, and it's so many different variables or so many factors that come in, and you just one size does not fit all, right? You don't know what happened for this to happen, the bad part of it. But I know you've, in doing all your study, you talked about social determinants of health, right? And that's a big long word to say to me where your zip code is. Okay, that's what it's saying to me. What type of factors are contributing to you maybe not getting the care or not taking care of yourself? So can you tell us a little bit about some social determinants that you found that were more prevalent in women who are having problems than others?
Some of those terms used interchangeably, but those are these kind of outside conditions, if you will, that ultimately impact one's health. So it could be where you live, where you work, the neighborhood you live in, the environment that you're in that contributes to your health and your health outcomes and even your mortality and morbidity. And so, zip code, where you live, where you were born, where you reside, where you spend the time of your life is the number one determinant of your health. So
Wow.
I could live in a zip code and 2 blocks over could be another zip code. And I could have a 20-year difference of a 20-year life expectancy based on is it walkable? What type of grocery stores are there? What healthcare access options are in that area? Park, the air, the environment, those type of things that impact our health. And so when we look at the issue of maternal health, the social determinants of health, it really depends on what the environment of that of that person is. And we do know that racism and discrimination acts as a filter through these social determinants of health. So even if I live in a zip code where it may be more affluent or more privileged or I have more access because I'm an African American woman or because I'm a woman of color, I could have worse outcomes than my white female or white male counterparts in that area.
Wow. So you touched on a word, I mean, you described a word that we're going to talk about, which is implicit bias. Okay. And I think that's kind of
Mhm.
like what you're talking about a little bit there. And we need to give the definition of implicit bias because, in my mind, we all have them. We all have some type of biases. So it's just not a white thing. It's a black, it doesn't have any color. Okay. So when I'll look at it, I'll tell you the definition, what I looked up. It says subconscious feelings, attitude, prejudices, stereotypes an individual has developed due to prior influences throughout their lives. And this can decide their decision making. So when you talk about the zip code, when you talk about all that, just the fact that a person will walk in, it's another color. They already know basically, and their how would I say, their persuasion will help them to say, well, they more than likely they don't have insurance. I don't even know how they got an appointment. So talk about that a little bit about implicit biases.
I can go on and on about implicit bias. Um, but first, so implicit bias, as you said, it's subconscious. It's our kind of just our internal response to anything. You can have an implicit bias against anything. It could be, race related. It could be gender related. It could be um, body makeup delayed related. It could be any of those things, and we all have them. No one is exempt from them. There is a
Mhm.
study that's given through Harvard University, and I'll send you the link, and maybe when this post, you can put that link up for your
I
viewers.
will.
But it's the
I will.
Harvard implicit awareness test or implicit association test, Harvard IAT. And there's all these different tests that you can take, but there is one for race. And when I first started talking about implicit bias in the setting as it relates to healthcare and talking with healthcare workers across the country, I wanted to take the test for myself just to see where I was. And I was shocked to find that at the time when I took it, it showed that I had uh, leaning towards favoring white people over African American people, and I was shocked. Me growing up in Inglewood, California, I went to a black college. I had the implicit bias, and that's when I knew that this situation was a lot deeper than
Hmm.
um than initially than I initially thought that it was.
Wow. I'd like to hear more about that. Why do you think that that was? I know that's
Mhm.
not the topic, but why do you think that you kind of sided that way? Is it what we are taught that we need to assimilate in order to get along, or what's your thoughts on that, real quick?
Yeah, so and it's not off topic at all. It really speaks to underlying root causes of why we have the issues that we have, right?
Hmm.
Um, so my theory, from what I've seen in my research of what I've done with just racism and discrimination in general, we have been ingrained, especially in this country, to put white concepts above Black concepts are above any other minority population concept. So it could go from anything from your hair to your skin color to the neighborhood that you want to live in to the
Hmm.
way you dress or the way you speak or the way you act. All of those things we have been taught, and it has been ingrained in us of white superiority and white supremacy. We have been taught and ingrained to put aside the African part of our African American. And that is by design. That was by design. This traces back
Hmm.
to slavery. When we were
Hmm.
brought over, our ancestors were brought over, they were not allowed to speak in their languages. They were forced to speak, English, which they had a hard time grasping that initially. Some people may have had that issue. And so they were taught to think that their native ways, their native religions, their native dialect was wrong and was bad. And now they needed to conform to everything that was being upheld as superior, which was the white way of life, the white Anglo-Saxon way of life. And so um, it's been ingrained in all of us, and some of us have a little touch more of it than others.
Mm, I like that. That's a very interesting study. Now let me ask you this: the fact that we do have that in us, okay, and the fact we're talking about that, do you think that that's some of the reasons why? Because let me intertwine health literacy into this. Do you think that we are more we might go to a white doctor and believe everything that white doctor says based on what you just said about how we think that their water is cooler, okay? That their water is colder than regular. So do you think what makes us just go there and just trust like that, and they have all this implicit bias going on, but we gonna go to that white doctor and believe that white doctor as opposed to going to that black doctor or whoever and don't believe him. And he's telling you the right thing to do. Let's talk about that.
Well, how much time do we have there?
Okay, we got
So
we
let's
got
let's
we
really
got
dig
about
into.
20 minutes. Go for it.
Okay, I'm gonna really dig into this, and I'm gonna try to keep it as brief as I can. But
Okay.
so research shows one that and I don't quote me 100% because I'm going off the top of my head, but I believe it's somewhere in the single digit percentages of physicians of color in this country. So
Mm-hmm.
black male physicians in this country are in the single digits. First time. So the opportunity to be able to choose an African American physician, especially one that is in a specialty that you may need, it could be slim depending on where you live, especially if you live outside of an urban area. If you live in a rural area or a suburban area, you may have a harder
Right.
time trying to find that. Number one. Number two, it is shown also in research that African Americans do not trust, um, not trust white doctors. They do have a propensity to trust physicians that look more like them and tend to fare better, have better outcomes, better health outcomes, and better adherence to whatever health instructions are provided to them,
Right.
well, coming from an African American physician, or if I'm Hispanic American, or what, whatever, just having someone that looks like me and maybe understands me more, I'm more apt to trust that person's decision than the white person. Um, a lot of times in our community, some of the health outcomes that we have are because we don't trust. Because the physician may have said, okay, I need you to take ABCXYZ 3 times a day. And we're like, okay. And we get there and we're like, I'm not taking this because I don't think this doctor's telling me, he's just trying to make me take this medicine. So I'm not taking this, and then don't take it, but then tell the doctor, yeah, I'm doing it. That happens more than people think,
Mm-hmm.
because there is a lot of mistrust. And there's good reason for mistrust. There's a long history of mistrust in our country. I went to Tuskegee University, so I'm very well aware of the United States syphilis experiment that was
Yeah.
conducted there. And there's tons of other um, egregious acts that have been carried out on Black bodies in this country. There's a history of it. Trying to think of her name off the top of my head. Harriet Washington. You can see this book, Medical Apartheid. It's a great book to
Mm-hmm.
read. She really digs into the history of the uh, very unfortunate acts that have taken place against African Americans from slavery up until today.
Yeah. And and they will trust. Let me just say this, that people just don't believe anything, because let's get into this, and this is really kind of goofy. They'll believe Google over a medical doctor. That's another thing that causes some of the morbidity and some of the mortality issues. Let's talk about that. As far as who do you believe? And everybody, for a good example, when COVID-19 was going on, everybody was like Dr. Fauci. Everybody knew what was up, right? Because of Google, because CNN, because of, whatever. I don't have anything against neither one of these people that I'm mentioning, but I'm just saying that how can we, okay, based on, let's go to implicit biases again, how can we, based on our own implicit biases, get past this thing that are killing our moms, killing our babies? How do we do that? What's your thoughts?
First of all, you brought up health literacy. Um, and I define that as just not only understanding, but also comprehending the health information that is being given. So I think that's a place where we can start. Um, I do some advocacy work where I work with people in the community to help them understand what their rights are. First of all, understanding that you have the right to ask questions. If
Mm-hmm.
your doctor prescribes you something and you're like, I don't know about this, I don't want to take this, check them. Have that
Yes.
conversation with your physician. A lot of times we're just like, okay, and we just go on instead of having the conversation, not to be confrontational, but to be more assertive and expressing what your feelings are, to advocate for yourself. So I think that's the number one thing that can be done, and informing yourself and making sure it's the right information. So you went to Dr. Google and you saw whatever it is. Okay. When you meet with your primary care physician, bring or your specialist or whomever, bring that to them. Ask them, Dr. Smith, I saw this on Google. I looked at all my symptoms. They look like this. Can you check me for this? Do you think this is what I have? Doctor might be a little upset at first, like, okay, I went and got all these degrees and stuff, and you're looking at Google, but have the conversation. I think a lot of times we just need to have just have the conversation. Don't speculate. You need to communicate. your communication with your physician is also a determinant of health. The fact that you're willing to have an open dialogue with with your physicians, whatever the specialty, primary, whatever, can be a determinant of health. If there's something that the physician says that you don't understand, if they're using all these words, I did an EKG and I saw a tachycardia and and you're like, well, I don't know what that is. Ask them, hold on, physician. You said this. What does that mean? I don't know what that means. Can you explain it to me like I'm a 3 year old or whatever? However you need to say it. But make sure you communicate and you get your questions asked when you're with the physician. And if you don't have the time in the office, I know sometimes there are time limits. Um, some insurance companies, not all, but some may have a nurse line that you can
Hmm.
call at any time. Call them and ask them.
You're right. You're right. And they got telehealth as well. Let's put that in there. Telehealth
Yeah.
is something that you can, but I guess what I'm always going to go for, I'm always going to go for the no excuse, that it's incumbent upon you, or it's your responsibility, moms, out there. If you're pregnant, just go to your doctor appointments. You find that a lot of them don't even go to the doctor's appointment. I've heard people say that she didn't come in till she was 8 months pregnant. What is that about? Why?
Well, well, that there's a lot of things that can go into that. That's not always negligence. If you look
Mm-hmm.
at it in this way, we talked about social determinants of health. If I am a single mother, even if I'm not a single mother, if I am a working mother, I work from 9 to 5, Monday through Friday, and I can only get a doctor's appointment 9 to 5, Monday through Friday. Most tough jobs, especially hourly wage job, I'm gonna have to take PTO just to go to the doctor. I'm not getting that time off, but I need this money. I've got a baby coming. So I gotta make a decision. Do I go to this doctor or do I work this hourly job and clock in because I need this job because they're probably not going to pay me my maternity leave, or I'm going to get reduced salary from my maternity leave if I have that coverage. And so that is where these social determinants of health impact our outcomes. You
Mm-hmm.
have to look at it from everyone, depending on their level of privilege, is making a different decision. So if I'm working my corporate job and I know I can just tell, my VP or whatever that I'm going to be gone from 2 to 5. I got to go to the doctor. Okay, that's fine. It's very different than someone who's working a job where they have to clock in, where they know me going to the doctor. One, I have to pay my copay of whatever that is. And then two, I'm losing money to go take this. So that's why some people don't show up. It could also be transportation. If I don't have a working car, if I don't have enough money for the bus, if I don't have enough money for Uber or Lyft to get to the physician's office, I can't afford to go to that doctor's appointment. I've got to prioritize something else over that. And so those are the things that contribute to people not showing up. I don't think it's just people like, oh, I'm not going to go to the doctor today, or I don't think it's always that. I think there may be
No.
other underlying things that contribute to those decisions that are being made.
And on that note, also they may have a doctor, but the doctor or the receptionist is not kind. Okay, you know what I'm saying. So it's some other. That's another social determinant they don't even talk about. Really, the reception that they get at the office may just turn them off. It's like, I'm just not going there because they always are rude, obnoxious. I just don't like it there. And to that I say, get another doctor if you can. Don't just not do it. You know what I'm saying? That's very important. Now, let's go to another topic, and we still got some time here. Let's talk about the mental health
Mhm.
of women. Okay, and I did read somewhere that after COVID-19, the mortality rate went up or something. Are you familiar with that at all, Dr. Flowers? Tell me a little bit about that.
Um, well, I'm not sure if you're saying like the direct connection of like mental health
Mm-hmm.
mortality
Okay.
connection.
Mm-hmm.
I'm not quite sure on that, but our life expectancy definitely went down after COVID-19. And yes, mental health diagnoses and mental health crises have gone up since COVID-19. That is very correct. And a lot of things play into that. Just the think the state of our of our nation right now. A lot of things are a little weird. State of our economy. Um, there's a lot going on in a lot of people's lives, and unfortunately, our healthcare does not provide a great coverage for mental health conditions. And so, again, if I want to go see a behavioral health provider, if I got to pay $100 out of my pocket for that, I may not have that. And so I've got to prioritize, well, and you know how Black women are. Okay, push through. I know my mom would say that. My grandmother would have said it. Okay, we don't have time to be upset today. You got to
Right.
go to work. We don't have time to be upset today. You've got to cook dinner. So push through. Push that down and push through. But that pushing through is honest. Um,
Hmm.
that's a whole nother segment, but there's a condition called weathering. And
Okay.
weathering basically talks about how Black women process, or rather don't process stress well. And the way it shows up in our body, because we're suppressing it, we're holding it back, we're pressing stuff down, and we're just pushing through. It shows up in our body as inflammation. It shows up
Hmm.
in our body as, heart disease, diabetes, other hormonal issues, all of these things because we are not
Hmm.
processing. It's called allostatic load, but it has to do with how cortisol, which is produced by stress, is processed in our body, or rather not processed well in our body. And so
Right.
that is a huge contributor to some of the health outcomes that we see in Black women.
Wow. That's interesting. It's weathering, in other words, just get through it. Okay, just do it. And
Yep.
it does. It does set up inflammation because it's going somewhere. The angry, the mad, the resentment, the whatever, it is going somewhere in your body.
It
So
is.
it's important to see it, know it, and acknowledge it. When we talk about mental health, go get the help that you need. Go get the help that you need, or better yet, tell somebody. You may not have the strength, or you don't know what to do, but just tell somebody about what you're having. And that kind of segues me into postpartum. Okay.
Hmm.
Postpartum depression, postpartum. A friend of mine, like I said earlier, had the psychosis, okay, of it. So postpartum is real. And some people say, just, I'll use your term, weather through it, but it's real. Okay. So
It's
what's
real.
your experience with that? Have you had any case studies or anything that you know, or clients or whatever that's had this postpartum depression?
I personally have uh, postpartum depression. Um,
Okay.
what we don't learn about once we become pregnant, that they don't talk about, is this fourth trimester, just basically, and it can go up to a year after you've had your baby. But if you think about it, you've been incubating a whole human being in your body, and then you have this baby. You're still producing some hormones to breastfeed and to nourish this baby for several months after you have the baby. Your body doesn't, if they think, oh, I'm snapping back or whatever, your body and your mind don't always snap back right away. And
Mhm.
there's a transitional period. And I know I experienced that pretty bad for a while. Um, and we are conditioned, as you said, in the back in the day, okay, great grandma had the baby in the field and she had to go back cooking cotton or whatever. So we think the 6 weeks that we get off is okay. She didn't, great grandma didn't have that, so we should be grateful for these 6 weeks. But in actuality, we need way more than that. And I'll say this: maternal mortality in the United States is really bad for African American women, but it's also bad for all women. We are
Okay.
at the bottom of the totem pole for wealthy nations, especially in relationship to the amount of money that our country
Mhm.
spends on healthcare. So it's not just impacting African American women, I think all women, even white women, are having poor maternal mortality outcomes in comparison to other wealthy nations. I know in
Yes.
other countries, women are given a year off and some assistance resources that, within to help. care for the baby, to take a nap, little things that we take for granted. So we have a baby, and when a 6 week period of time, 8 weeks, whatever, 12 weeks, whatever you have for your job, you've got to, figure out how to adapt to your new life with this baby. You've got to, breastfeed and hopefully figure out if you're going to wean them if you don't have a job where you can pump and get yourself back in the right mindset to get up and go to work. You're sleep deprived because the baby's not sleeping. All these things that are going on, it's your hormones, it's the sleep deprivation, it's the change in your life. All of these things that make everybody go crazy. And so that's one of the things that contribute to postpartum depression, postpartum psychosis. Um, that can lead to some very unfortunate circumstances for some people, for the
Mhm.
baby and also for the mom.
Yeah, you're right. So, hey, Dr. Flowers, this has been a good time, and I need to bring you back and we can talk and chat it up a little bit more. But I think we hit on some really good points to just have people to understand. And I'm just not talking to women, I'm just talking to people, period. That health equity is serious and it's an issue. And I talk about African Americans because we always be high on the totem pole, but whatever, diabetes, high blood pressure, blah, blah, blah. We got it, right? Okay, thyroid, and whatever, we always have it. So when we talk about women and their health and the health of their babies, that's how we replenish the earth, right? So it's
Yep.
important that you understand that women are not just having babies and going on their merry way and say, I got a nice little baby, right? And I'm doing okay. They're not. They're suffering. You need to be out there in the community, taking care of them or seeing you see them, hurting or whatever, they may not tell you, but just look at their face, just look at their movements, or what they're doing. They used to go places, they don't go anymore, even though they got a babysitter. What's really going on with that person? So all these social determinants, as Dr. Flowers was talking about, is important. And it's just not what they write in the books about social determinants. It's a lot of different things that comes together. And I always said it make a dangerous cocktail. So, Dr. Flowers, is there anything else you want to add before we end tonight?
A couple things I'll add. If you or someone you know is experiencing postpartum depression, postpartum psychosis, or any type of feeling where you just feel like you're not willing to continue on, you can dial 988 from any phone in the United States, and that will put you in touch with a mental health professional that can get you some help for that situation. And also, just remember to advocate for yourself. If you have a question, if you're not sure about something, speak up and keep speaking up until your voice is heard. I'll end with those two tidbits.
Okay, and I want to also end with something that Dr. Flowers wrote. She said, and I'm getting to it. Y'all just wait. Hold on. I got it. That maybe I don't have it, but it's about everybody deserves to have safe, fair, equitable treatment. Okay. And I'm trying to remember from the top of my head, but that's what
Yes.
we say and that's what we stand on tonight. So, hey, without further ado, we're going to end it tonight. But guess what? If you like what you hear, or if you don't like what you hear, you can subscribe, because I'm coming back with some things that I think that you may be interested in. And please share this with a friend, health equity, postpartum, and all those things that affect women, and they also affect men because the women are with the men, right? So everybody is affected by this. So until next time, this is Marilyn Green, girl who don't you know, hostess with the mostest, signing off. Take care. Bye bye.